moved some stuff around, got me in Friday, which was just 8 days after my first surgery.
That's uncommon.
But if you go to here, to this area, is 7 exactly.
That's not really true, right? Plus that area just looks still quite crusty. Let's react to this video by Christian Guzman called I Re-Did My Hair Transplant.
8 days ago, I went in for a hair transplant, and today I went in for round 2. Here's why.
So he already had a hair transplant. Oh, interesting. 8 days ago? That's interesting. Okay, we gotta listen in here. It's very rare to go back. I've heard of people, doing back-to-back days. That's one thing, but to go back for another one 8 days out is a bit unusual. So let's listen in.
Last week, you guys saw me go through and recover from a hair transplant.
I guess I missed that one. Hopefully he recaps it here.
And if it wasn't already clear by the size of my head, it was quite an experience.
Yeah, some people put some tape or like a strap or headband around the forehead to try to encourage the swelling to go around that area. It's definitely one approach, but it'll always find its way down. And sometimes I feel like it puts a little too much stress on the actual transplanted site if you're blocking the swelling from coming down. So usually I recommend just letting that swelling, letting that edema drop down. And by day 6, 7, it's almost always completely gone.
When I originally went in for my consult, I was told to expect 2,500 grafts taken from my donor. The donor means the side and back of your head, and maybe a few hairs, like 500 or so from the beard.
I think it's always risky to give people an exact number of this is how many grafts we're gonna do, because you never really know, come surgical day, how exactly it goes. Some surgeries are more challenging. Some donor areas are just not as full of grafts as others, and some people come in with prior surgeries, and and you just never know how the flow is going to go of the day. So I think it's good to give people a general idea, maybe a range. We usually do a range, and then the finances can also be different from clinic to clinic. Some people will sort of guarantee a certain number of grafts, or they'll just have a price per graft with no minimum. So everyone is different in the way that they charge. But as far as guaranteeing 2,500 grafts, usually I find it's not the best approach, even if you feel pretty good about being able to get that in a day. But just giving the person maybe a little bit of a wider range to give yourself some room for just flexibility. Maybe the recipient area is actually smaller than what you originally projected it would be. If it's a hairline case and person comes in and they thought they maybe wanted the center to come down a centimeter, but then they thought about it between the time of the consultation and the actual surgical day, and maybe they've decided, oh, I just want a little bit of improvement in the corners without any significant drop. Well, that's going to change the number of grafts, as it should. They don't need as many. So if you told them, I'm going to get you 2,500 grafts, well, what if you only need 1,500, 1,000 grafts? What's the point of harvesting more than what you need, right? So anyway, that's why I think ranges are the way to go.
However, when it came to surgery day, even though we started at 7:30 in the morning, we were only able to do 2,152 grafts, which for my research is actually quite a lot to do in a day. With that said, nothing was taken from my beard.
Yeah, beard hair is not something that I ever incorporate in the initial surgery, unless maybe he's had a few surgeries in the past, I'm not sure. But this is his first hair transplant, and he has a pretty average amount of donor hair. There's no reason to incorporate the beard hair in surgery number 1, unless he has a ton of depletion. And some places around the world will basically do these kind of giga sessions where they'll do a lot of body hair all together. But if it's just from what I can tell, I'm not sure yet, but looks like they did some frontal work, assuming they didn't also do any crown work. One procedure into the front from just scalp only would be how I would have started, but it looks like maybe they promised him some beard hair and then ended up not doing it. We'll keep listening.
At the beginning of my first surgery, the doctor said this:
You may wind up needing 2 procedures if you don't respond back here,
At the first procedure, I ended up paying for 2,500 grafts up front, $7 a graft.
Oh, I see. So he paid for exactly the number of grafts. So that's why he kind of expected that number. Now, there's different ways of doing this, again, from the clinical side. But if he was guaranteed that number of grafts and just, didn't get it, I can see why, he'd want to come back for more. The question is, when is it a good and safe time to do more grafting? Is 8 days the optimal time? We'll get into that.
And a few days after the procedure, when I realized, hey, we only did 2150, I called the doctor and just was being sure I was going to get refunded for the difference. And they said, we can 100% refund you. We did, however, think that you were going to come back and kind of finish up those 2,500. And I know we talked about the beard in your consultation, but my mindset there was, you know what, go ahead and just refund me. I'm pretty happy with how this went, and low-key, I feel like I had just undergone so much. And so in my head, I was sort of in the mindset of, if I'm just gonna go back in a few days or a week to just get a little bit of a touch-up, I'd almost rather see how this first one comes out, and then in 5 or 10 years, just do a bigger second transplant.
Yeah, or even, a year later. But I think that's a good measured approach of kind of seeing the results from your initial work without going crazy with the number of grafts harvested. Because, if most of your available donor supply is taken in one surgery, if you want some adjustments, you're not going to have too much left to work with. So I think he has a good point of, they did a solid procedure, and, he can just come back and see if he's happy with that, if he wants some adjustments, if he wants some improvements, some tweaks. I think that's actually a good point.
That's kind of what Heidi and I talked about, and I was like, yeah, I think that makes more sense. Throughout the week, I was sending my doctor just updates, and he ended up calling me after I had done the refund and said that, look, if you really want the best result and you want the most out of this experience, I would really recommend considering coming back to let us do some remaining grafts, but mainly do the beard. The beard is DHT resistant hair. So all the hair on the side of your head, the donor, that's not DHT resistant.
That's not really true, right? So the reason why for FUE, we go for the hair on the side and in the back is because it's DHT resistant, right? The kind of whole central corridor in most men and many women is DHT sensitive, right? So it has the potential of being impacted by DHT and miniaturizing. So for most people, they have that kind of horseshoe that's left behind with androgenetic loss. And that horseshoe is what we're using for harvesting FUE, or in the past, or even currently in some clinics, FUT surgery, right? It's taken from the heart of that horseshoe. So it's not accurate to say that DHT resistance only comes from the neck. The neck hair tends to do quite well on the scalp. The issues with the neck hair or beard hair is that it grows in more curly on the scalp. So for someone with curly hair, it might not matter as much. For someone with straighter hair on their scalp, there will be this kind of a texture mismatch. So that's one of the things. And plus, there's a limited supply in the neck area. I personally don't like to harvest from the face. I like to go underneath the mandible, just not to leave any scars on the face. Other people will harvest from facial hair as well. But again, there's limited supply there, and that is one of its limitations. Also, the regrowth potential when it comes to scalp hair versus beard is a little bit different. Beard hair still has a very high survival rate and ultimate, kind of regrowth and persistence, of the hair not fading over time, but it's not quite as high as for scalp donor.
DHT is essentially what causes hair to thin, in layman's terms, and the hair in your beard does not respond to DHT. So if you take hair from here and put it here, it actually stays in permanently. It's a lot thicker. It is a different texture, and so you have to kind of be strategic with where you place it in the front. But to fill in some of the front area and then kind of take it back further, would help have a better result.
Yeah, that's why we don't use it with usually surgery number 1 or 2 for scalp hair transplants. We'll sometimes incorporate beard hair if the person comes in and they're overly depleted from prior hair surgery elsewhere, or if they've had at least 2 surgeries with us and we feel that, at this point it will help our numbers for our density to start to incorporate some of the neck hair. That's kind of how we introduce neck or beard hair. But again, everyone's got their own protocol.
And after looking myself in the mirror on the first week of recovery, I really did notice.
Okay, so I see it there. So they worked through most of his frontal scalp into maybe a small amount of the mid scalp. So I don't see any crown work done. So yeah, about 2,500-ish grafts should have been enough for a substantial improvement. So I guess they initially did about 2,150 and then they offered him some more from the neck hair. It's fine. I think 2,500 from the scalp would have been a really nice kind of game plan for that area from the get-go. But again, it's a surgery, right? So sometimes you run into various things that might slow you down. It could be a lot of bleeding. It could be a difficult scalp where when you harvest, sometimes there's not great integrity of the skin and it might be a more difficult harvest. Sometimes the angulations of the hair are trickier to follow. So there's lots of things that could either make the surgery go really, really smooth or actually slow you down and make it harder to do.
So after the call with the doctor, I decided, you know what? I'm already healing. I'm already like in the month of September, taking all these weeks off from the gym. I'm already in it. So how fast can you get me in? And also I have summer shredding coming up September 12th, 13th. So I need to kind of be healed up by then.
I think he said summer shredding, but it's funny because at first I thought he said shedding and then I realized it was probably shredding because I think he's like a gym guy.
He moved some stuff around, really helped with scheduling and got me in Friday, which was just 8 days after my first surgery.
That's uncommon. The thing is this, after a couple of days set in, after a transplant, like there's a lot of inflammation. There's a lot of healing that's going on. So to go back in, especially into the same area, to kind of re-traumatize the area, kind of sets back that healing and potentially could interfere with the survival of the grafts from the initial surgery. So it's one thing if you're doing back-to-back days, and let's say in the first day, you've worked on the frontal scalp, and the second day, you work more into the mid-scalp or maybe the crown, and you have different sections that you're working on. I think that is a bit more commonly done if there are going to be multiple days, as opposed to waiting a week and then coming back in and doing some more into the same area. That is a lot less common, but it could be that in this doctor's hands, he's comfortable with that and has done it before and hasn't seen any problems with, overall results. That's probably the case, I'm assuming, or else, why do it? In my practice, by the way, in terms of additional work, like for more density, or if there's a different area that we're going to work on, we like to wait at least 6 months to see some of the early results from the initial surgery before we start planning for any additional work. So by the time patients come back in for a second surgery, it's usually about 9 to 12 months from the first if they're looking to really kind of push it and do more work. So most common scenario is someone comes in for frontal scalp work, but they're thin all throughout. And we, at 6 months, if we determine that the regrowth is sufficient and we're happy already, and we know it's only going to get better and better, over the course of the whole first year, we then will start to plan for a secondary procedure to address the areas further back. And by the time they get back on my schedule, maybe about 8-9 months have passed from their initial surgery. But again, this is working into a different area. If we want to work into partly at least the same area as the first surgery, then I like to wait at least a year for more maximal regrowth of the transplanted hair. So I can really see like where I need to place additional grafts.
You're going to do this again. I've got all my medications here. Yesterday was the first day that I was able to shower with like shampoo normally, which felt fantastic. I mean, I was still like super gentle with it, but just felt good being in the shower. The itching has been like peak. On day 6 of recovery, The itching got really bad, and pretty much my sleep, you may see my eyes, like I have not been sleeping good.
Yeah, so it's just going to add insult to injury as he goes for round 2.
I am just ready to have whatever needs to be done today to give me the best end result. We're already in it, you know? And honestly, let me show you. So when I look down like this, it's kind of shocking to me that I never really noticed much of my back hair getting thinner, so like bad. But now that I look down and see that it's growing back just like so faint here on like the second half, that's where I want to kind of keep taking this back a little bit further.
Yeah, the thing is though, the crown's going to take a lot more hair to really kind of fill in. So we'll see how much they get for him from the beard, but let's see if it's enough to make a substantial impact.
Got the numbing cream on the neck, head, back of the head.
The reality of the situation is that symmetry is not natural. The stripes on a tiger are not mirror image of each other.
That's true. Yeah, I mean, there's no such thing as perfect symmetry. He has a good point.
There are irregularities in nature that are consistent with nature. It's like if you look at a cheekbone and you have, your cheekbones sometimes are off, yours are not too far off, but one side is not the same as the other. But it's in the general ballpark, okay? So we measure from the glabella to the hairline, it's like 7.1 or 2, okay? If we measure from the peak of the eyebrow to the frontal temple junction, it's like 7.1 or 2. So it's the same. You come here and you measure from here to there, it's like 7.3 or 4. So it's not exactly, but if you go to here, to this area, it's 7 exactly.
But again, he's very swollen, so it's very difficult to get an accurate measurement. Ideally, they would give time for all the swelling to go down, and then if they are planning on adjusting anything at the hairline, which it seems like they're planning on doing, to do it in this inflamed state, I think is suboptimal. And I would, first, it's best to really define the hairline and as much symmetry as the patient wants or the doctor wants or sees fit before doing the first surgery. Once you have that, you kind of stick to what you did, because again, with the swelling, it's very hard to tell if one side's a little higher than the other. And then you give it time, and you can come back a year later, create a little tweak if needed, which often it isn't if it's properly designed in the first place. But this is a dangerous time, in my opinion, aesthetically, to sort of give in to patients' demands occasionally for, but it's not exact, I want it better. Especially when it comes to the hairline design, because of all that swelling. You just can't tell. It's impossible to tell, because as it settles down, it might actually look perfect or near perfect. And if you've made some tweaks, you can adjust it in the wrong direction. So that's my caution here.
We're going to make one small tweak here. I kind of want to fill in just a little bit.
Plus that area just looks still quite crusty, even crustier than the rest. Chances are there's even more swelling there compared to the other side. And swelling will often drive the hairline up higher, or, the illusion of it higher. I think aesthetically not, maybe an ideal move here, but again, everyone's got their own way of practicing, and this has probably worked for this team before, and I'm sure Christian's still going to do great.
That's the only adjustment I really have, separate than just kind of filling it up more and taking it a little further back. So earlier I mentioned just kind of like filling this area. The doc says we're actually going to add a few more to this front area as well, just to help thicken it up.
Again, it's just tricky, because when it's all inflamed and you still have crust, it can be difficult to judge if the density is sufficient enough, especially when the hair is at such a low format and, is cut short. Again, I would do things a little differently, but I think, this is one way to do it.
Super excited. Day 2. Let's go. We started a little bit different today. Instead of extracting from the back, we actually started with punching holes in the front. I had that small adjustment here on the left side.
Yeah, usually in my practice, we'll start with site making first. This is the first main part of surgery. It seems like they did that for him this time, and that helps set the stage for then how much you need to harvest when you go to the donor area.
And then we kind of filled in the area with last time and then took it further back. It was about 1,000 hole punches. I went into this thinking I already know exactly what to expect. It's gonna be a breeze, nothing could go wrong. This time hurt so much more than the first.
Yeah, that's exactly what I was referencing earlier in my comments because, again, so much inflammation. He's still in the healing phase and you're coming back and you're re-traumatizing that area. Of course, that's going to be a lot more sensitive, a lot more painful.
Kept telling myself it's fine because the result will be so much better. Numbing the front is definitely the worst part. After all was said and done, I let the doctor explain the benefits of using beard hair.
We use some beard hair, which have larger caliber, so they're coarser hair. But the big benefit of using beard, DHT attacks the hair in the pattern, and sometimes outside the pattern too, on the sides and even the back, and it starts to shift the follicles from higher number of hairs to lesser number of hairs.
And again, like, yes, the donor area can shrink a bit as time goes on, right? That horseshoe can get smaller and smaller in people. But that again highlights the importance of medical therapy like finasteride, right? Specifically finasteride and or dutasteride to limit that continued loss so that you're not just helping some of the native hairs in the DHT sensitive zone, but you're also helping protect some of the transplanted hair from the DHT resistant zone. Because remember, with FUE, we harvest broadly and some hair on the periphery could still be sensitive to DHT. And again, we've got our feelconfident.com website for actually prescribing the finasteride and minoxidil for people who are interested in that, where it ships directly to your door and it's more affordable than some of the competitors like Hims, right? Again, no matter where you get it, the point is to be on it, because if you want your hair to be as optimal as possible way into the future, don't just depend on surgery. You know, have the surgery be layered on top of good hair maintenance and protection.
And some of the hairs may become finer. While DHT miniaturizes the hair in the pattern, it stimulates the growth of the beard. So I've incorporated using more beard hair to blend with the scalp hair, the stronger scalp hair that he had.
Yeah, it's not a bad approach. It's just there's a limited supply and it's going to grow in curlier, and it's not the best to use at the hairline. But yes, throughout the rest of the scalp, usually it can be incorporated if need be to augment results.
To give him the best result possible for him.
And what we noticed on the first round was that like a lot of the grafts that we pulled on the first round, you were saying they weren't great quality, right?
Yeah, so normally, you know, the amount of single hair is about 15% in a normal scalp. He had a larger number of one hair.
Now, it could be that that was because of his miniaturization, sure. It could also have been because the punch size was not big enough for him, right? Because everyone's got different caliber hair. And sometimes for FUE, we need to bump up our punch size in order to capture those 2, 3, and sometimes 4 hair grafts. And if people are used to using the same exact punch size for every single case, especially if it's a relatively small punch size, you can sometimes partially transect and miss out on some of those larger families of grafts. So that's really important. That's more of a technical point, but one that is relevant, I think, in this case.
Non-surgical treatment should shift back and bring some of those hairs, which were miniaturizing, back to thicker hairs.
And again, the best for hair that's miniaturizing to improve the state of it throughout the scalp is going to be a nice combination of finasteride and minoxidil. That's the most common combination that most of my patients are on, whether they're getting a hair transplant or not. And they don't just get a transplant and then they come off the medications, right? They have to sustain the medications, continue on them. That's very important for good long-term success.
I'm in more pain and soreness already, like way more than day one. Walking out of day one, I felt pretty normal. I'm definitely going to be chilling out for the next few days. So now we start our full recovery. Again, the point of doing this back to back was pretty simple. There's no point in waiting, and I want the best results possible.
There are benefits to waiting, right? Part of it is that he gets to see the results of the initial surgery. Now, we're going to assume that everything from the first surgery is going to grow out beautifully, but you just never know. There's lots of variables when it comes to hair transplant surgery. You just don't know. So what if he feels that most of this is still a little bit thin, but now he's invested a lot of his grafts into the crown, let's assume here, right? But he might want a lot more back into the frontal area for increased density. So that's why I believe in kind of going a little bit slower and building things up gradually over time. There are different approaches to this, but that's more, I guess, my approach currently.
So with all that out of the way, here's a breakdown of what we ended up doing. First procedure, we had 2,152 grafts taken from the donor and put onto the front of the head. On procedure day 2, we took another 83 hairs from the donor.
83? Okay.
Donor, and put that in that one spot that I wanted to kind of line up.
Oh, I see. So they took 83 additional grafts from the scalp to basically line the left hairline. That's why they used that. And then they put the beard hair further back.
And we took 939 from the beard and placed that here in the top and also helped take it back a little bit further.
Oh, so they did use some of the beard hair in the frontal scalp, it seems, for some additional density. Interesting. That's a pretty solid number from, especially from just the neck in a single surgery.
Which was more than the 500 that I initially expected on the consult, but again, I was already there. I was ready to do everything I needed to for the best results. So in total, for my hair transplant, I had 3,174 grafts done. This should hopefully make for a pretty full head of hair. And of course, I'm gonna keep you guys updated through the journey.
Yeah, it depends on his degree of thinning preoperatively. I'd have to go back and see, but that number for someone who has a lot of thinning in the frontal scalp area, that's a good number for just that area and into maybe part of the mid scalp. When you're talking about, pretty complete crown restoration, depending on the size of the crown, it'll consume at least that number. And usually you get a better bang for your buck with frontal work because of that shingling effect in the frontal scalp relative to the whirl pattern of the crown. It'll take a lot more grafts in the crown to generate that same appearance of density.
Combination of the last 3 nights, like not sleeping because of the itchiness in my scalp or my hair, like literally 3 hours max per night, with the second surgery today, just having my scalp so sensitive already, I'm in like a lot more pain. Here, especially here.
It's another advantage of just giving it time and coming back, closer to 9 to 12 months post-op instead of 8 days.
But everything overall just like hurt more today than the first time. I'm gonna definitely chill out a lot more than I chilled out last week. I feel like last week I just jumped right into work, like too quick. It's a good thing it's Friday right now. We ended up finishing about 3 hours earlier than session 1. It was a lot less grafts, but that's good. You can kind of see like the beard here. That's not hurting at all right now. It's literally just like the head, but really this area where we touched up. I've got the red light glasses. I'm hoping, like, these normally help me sleep. I haven't been wearing them because of all the stuff, but we didn't take any hairs from here. We only took a few hairs from the back of my head. So I've got these just to hopefully help me like sleep. And because I'm spoiled, I got some Baskin Robbins cookies and cream ice cream on the way. Thanks to my wife. This is like a lot worse than day 1 than the first one, for sure.
Well, thanks, Christian, for sharing your journey. It's a lot to be, so forthcoming with your experience and, just complete transparency, which is like always welcomed, and definitely enjoyed watching it. I enjoyed listening to your doctor's perspective on how he does hair transplant surgery. I'm always learning from people, from around the world. It seems like he went to someone in the United States. I go to international conferences several times a year these days and have friends and colleagues from all over the place. And there's always something new to learn, different techniques, different protocols, different equipment that people use. I think it's important in this profession to never stop learning, sharing knowledge and experience. I think super critical. And hopefully you guys learned something from my perspective on Christian's experience. All right. See ya.